and welcome back to the Everyday Therapist. I'm Dr. Deb, and this is a place where we talk about therapy and psychology, both from research and practical points of view. And I haven't put out a video for quite a while because I've been out of the country and here and there with various events and family things going on. So this is the first time I've really had a chance to get back into it. So, in our last video, we were talking about ways to treat trauma. And today I'm going to continue to talk about ways to treat trauma, and specifically with regard to three of the very uh, practical or popular ways that therapists now treat trauma. Now, and they're all kind of related because they all have the same goal, which is to take implicit memories, those flashbulb memories, and turn them into explicit memories that a person can actually talk about and talk about it to an extent where the person does not become emotionally overwhelmed or re traumatized. So, the first one, which is kind of the basis for the other two, is hypnosis, hypnotherapy. Now, people say to me, Deb, I cannot be hypnotized. I don't think you can hypnotize me. Well, the thing is, most people already go into hypnotic trances every now and then, even though they don't realize it. So, for example, if you've ever been driving down the road and you get kind of lost in your thoughts and you find that you've gotten to the place where you were going to, and you don't remember any of the trip, well, you were in a bit of a trance. Or if you're watching TV and you kind of zone out in front of the TV set, you are in a trance. And actually, advertisers know this, and so they will do things to kind of get you in a trance and be susceptible to their messaging for you to buy their products. Uh, and other times, people end up in trances as if they become uh, overwhelmed by stimuli. Say you go into a big box store, say Walmart or someplace like that, when it's really, really busy and there's all sorts of noise and maybe music going on and a lot of distractions. Many people just kind of shut down a bit and they're walking around kind of with blinders on. That's a trance. So the thing is with hypnosis, it is working with somebody who is helping you as the client intentionally go into a trance. So, how does this relate to trauma treatment? Well, uh, there are various ways to use hypnosis to help with trauma. One way is to get the person all comfortable and in a trance uh, and just feeling open to suggestion, and the therapist will help the person stay calm and mentally walk through the trauma. Also, sometimes the therapist will help the person uh, experience some of the emotions that went with the trauma, but then help the person calm down from those emotions. And then, usually, as the therapist is bringing the person out of the trance, the therapist will uh, instill some positive ideas for the person to keep in his or her unconscious, such as I'm a good person. I did the best I could in the situation. I will move forward in a healthy way. Those sorts of things. When I do hypnotherapy, I make sure that unless I think there's a danger, I make sure my clients remember all that has gone on in that therapy session, just so they know that I'm not trying to implant any ideas other than ones that are helpful to them. Okay, so that's about hypnotherapy. And if anybody has any questions about it, please leave them in the comments and I will answer them. Now, the next very, very popular, in fact, it's now more popular than hypnotherapy, is eye movement desensitization and reprocessing, also known as EMDR. Now, let me give you some history about EMDR. It was developed or initially codified by a researcher by the name of Francine Shapiro. Now, Dr. Shapiro, when she came up with the basic concepts, was attending a training session on hypnotherapy. And during lunchtime, she went outside to just get away from everything because she was trying to process some troubling things in her own life. So she was sitting on a park bench, and she realized that as she was thinking about the situation and trying to calm herself down, that her eyes were moving back and forth. So she thought, well, maybe this movement back and forth is actually helping me calm down and re understand the situation. So she began to do a lot of research on it. In fact, it's considered an evidence based treatment approach because there's a lot of background research behind it. So, uh, initially, therapist, well, let me give it a little bit of an explanation of why it works. When I think I mentioned several videos ago that one way to calm a person down is through lateral motion, side to side. And it doesn't have to be just the whole body. It can, what Francine found out was the eyes moving back and forth helped her stay calmer. So initially, when therapists started doing EMDR, they used their fingers and just had people follow the finger back and forth. Or when therapists realized that was too tiring, they used the light bar. Lights going from one side to the other, and the client was just supposed to watch the lights. Well, that became a bit bulky, and more research indicated it wasn't the eyes that was the calming thing. It was just that sort of lateral stimulation. So nowadays, therapists use what are called TheraTappers, and basically they are about the size of two eggs. You hold one in one hand, one in the other hand, and they vibrate, and they alternate from side to side. And the therapist will initially make sure that the buzzing level is comfortable for the client. And while the client is processing, because the lateral motion is what's calming the client down as he or she's processing, the therapist will be slightly manipulating the speed of the vibrations because the idea is to not let the body become overly uh, sensitized to the speed because then the body will just sort of begin to ignore it. So let me explain the whole process for EMDR. Okay, the client and the therapist have sort of worked through the client's trauma uh, timeline. And normally, what the therapist will do with the client is choose a sort of minor trauma, just so the person can begin to understand how the whole system works, the whole process. First step is to help the client have some internal cognitive resources to help them stay calm through the whole process, whether it's thinking about, okay, who would be a good friend that or support person that you could turn to as you're mentally processing these things. And it can be anybody. It can be somebody who's real, somebody who's out of from a book, sometimes it's a pet. And also, uh, coming up with a mental container to put all the problems of the day into the container while the person is working it through. So to help the person stay away from being distracted by other things. And other sorts of support such as that, maybe armor or anything that the client and therapist decide the client needs in order to work through this trauma. So those things get all uh, helped into the client's mindset, basically, and then to move on to the next step. The next step is for the client to identify the trauma in many different levels. First, the client is asked to picture this, the situation and then to identify emotions that might have been involved in the situation and physical sensations like tight muscles, upset stomach, and then cognitions that the client may have had during that situation, such as, I don't know what to do, I'm scared. You know, those sorts of things. And so at that point, the therapist will turn on the TheraTappers and ask the client to mentally work through the trauma story in in internally, not saying anything or anything like that. And so, as the client does that, every now and then the therapist will stop the client and say, "And what is going on now?" Uh, the therapist may ask the client to rate uh, her current levels of distress on a scale from 0 to 10, with 10 being the highest, and 0 is no distress at all. And the client will continue to work through the trauma, uh, and with the therapist stopping the client every now and then until the client can go through that whole thought process with ending up with a level of distress that is 0. So that means the client can think about that situation and not get upset about it. At that point, the therapist will ask the client to come up with a positive message to give to the client's self about the situation, such as, "I did the best I could." Uh, Then the final step will be for the therapist to ask the client to do sort of a body scan to see, to sort of come up with the initial picture again, the one that now there should be no distress thinking about, and have the client notice if there's any tenseness or anything like that in the body uh, while the person is thinking about that. So that's basically how EMDR works. And let me pause for a minute because I have to let. Well, I'm back. I let the little dog into the room with me, and she's down in the corner there. So now you know the basics of EMDR. Well, there is a related therapy technique which is much newer than EMDR called brain spotting. And it is very similar in that it requires um, the client to focus back and forth. And in brain spotting, it really does go back to using the eyes and tracking the eyes. When the client is going through his or her story internally, the therapist will watch how the eyes are moving, from side to side. And if the therapist sees that the client's eyes kind of stop and maybe jiggle a little bit, the therapist will stop the client at that point and ask what is going on and what feelings may be associated with that point in the story. Because uh, what happens is when the client's eyes get to that point, usually there's something deeper going on, sort of a mini trauma within the bigger trauma. And so that means the client needs to process that set of emotions and the message that the client has given him or herself about that moment. So the therapist and client will work through that moment, and it may end up getting down to smaller and smaller mini traumas within the larger one. And so the ones they get resolved, and then the client builds back up, going back to the main story, and this whole process continues. Now, I have never been trained in brain spotting. I did go through a brain spotting session just to find out what it was like. I mean, I've been trained in EMDR and hypnotherapy, and I've used both of those in a lot of situations working with clients with trauma. But I haven't used brain spotting with clients. But it is a technique that many people find to be very useful. And if you think about it, it does help to get down to the deepest levels of the traumas that a person might have. Now, in the past, I've mentioned how trauma, the more uh, difficult ones, tend to be blocked off. And the reason why, when we use EMDR, we start with a sort of not so uh, all-consuming trauma is because as the person learns how to use the process, and the same happens in hypnotherapy too, as the person learns how the process works, other traumas begin to surface, including the ones that may have been blocked for decades. They start coming up, and there's this client starts having little bits of memory, and the memories get larger and larger and larger, and then the client can start to process through all of those emotions and sensations and cognitions about him or herself in the situation. Now, there's also a reason why EMDR has become very popular, and it has to do with therapists themselves. When a therapist and a client work using talk therapy, the therapist hears all of the trauma that the person has gone through. And sometimes therapists will end up traumatized. It's secondhand trauma. Uh, with EMDR, because the client is not giving the details of the situation out loud to the therapist is somewhat insulated from secondhand trauma. Now, in my own experience, what I have found is that uh, working with clients, usually I need to use a combination of talk therapy and hypnotherapy or EMDR, depending on where the client is in terms of the processing. Um, and they go back and forth from each other. The client may have a stated trauma. We talk through aspects of it. Then the client will process it either with hypnotherapy or EMDR. Some other things may come up again then. And so we talk through, identify aspects of it, uh, and then maybe do EMDR or hypnotherapy. But it's sort of cyclical, but the whole goal is to get the memory such that this client is not upset by the memory, and the client has been able to move it from just emotional flashlight memories to more explicit memories that he or she can talk about. So that's all I'm going to talk about in terms of treatments today. Next time, I will talk about another area of trauma treatment called somatic therapy, and we'll talk about that next time. Now, usually I bring out some little uh, tools that can help with moderating emotions and things like that. Well, I have a little feedback device that basically, let me grab it, has headphones and a sensor, and it will, here's the body of the thing, it will give feedback through auditory feedback as the person learns to lower the blood pressure. I mean, not blood pressure, pulse, sorry. Because we know that if we can control our heart rate, usually through breathing, then our blood pressure will go down and we will feel more relaxed. So that's what this little tool does. Now, thing is, I show you all these little tools. You don't need to buy a little tool. You can just go onto YouTube and find videos about using binaural beats to change your brain wave state. So you can help with meditation or anti-stress. So those are things that are out there. There are uh, tunes on Spotify that are geared for relaxation. So I suggest that you explore these things and try them out to help. But I will keep bringing up different things like that. Now, that's all for today. If you found this to be useful, please give a thumbs up. Uh, Share it with friends and family that you think might find it to be useful. If you have any questions that you want me to address, please leave them in the comments because I will uh, come back and give a video or answer your question in the comments. So that's all for now, and thank you for being here with me. See you soon.